Good evening, ladies and gentlemen. My name is Hafsa, and I'm here with Stefan, and the rest of our group is basically trying to address the problem of psychological stress in medical staff. So we wanted to look at how we might reduce the stigma of psychological stress for medical staff so that they can thrive in the workplace. So stigma often arises in medical staff because a lot of the statistics we looked at said they feel some sort of embarrassment to admit that they had a problem with work, and sometimes they felt that was an impediment to their career ladder. So they often kept it to themselves, and that can just boil over and essentially create a problem for the organization. All right. So why are health professionals highly susceptible to psychological stress? Well, we looked at some of the risk factors, and it's actually quite paradoxical because the expectations that a health professional is supposed to have are actually the risk factors that make them more susceptible to psychological stress. So in terms of looking at it as an organizational point of view, it's important that we address this issue because if you have an increased stress, you're going to have a lower patient care, and that's just going to increase your chance of patient death. In terms of costs and financing, we had a look at that, and it basically came out to be a cost of $3.6 billion to the economy to treat physicians who are going through stress or burnout. So we wanted to come up with ways where we can create a community where open communication and dialogue can exist. So we came up with an app called MetaThrive.
So the app is actually an integrated solution, not just an app, but it's a communications platform as well as a real-time physiological tracking platform. So it addresses three things. First, it allows the sufferer or the user to vent. Second, it serves as a platform for communication. And third, it serves as a platform for real-time physiological monitoring and feedback, because some of these stresses are very time critical. Alright, so in the venting, we came up with a hashtag system whereby patients or users of the app can use color scheme to represent their emotional states, and it is completely anonymous, generating data for the organizations they're working for. And over time, clinicians as well as their supervisors can use this data to come up with the appropriate interventions. So they can also self-report issues they are facing. For example, multitasking, which is very common and leads to burnout. Another thing is the volume of work and conflict that they are experiencing. So in the app itself, it actually has a button which is for complaints that will be submitted confidentially to their supervisors. More importantly, to address the time-critical features or time-critical phenomenon of stress, we actually have a real-time wristband that's like acts as a wearable. So what it does is that it actually feeds data into the app and it tracks real-time blood volume pulse to indicate stress levels. And as you can see in the circle diagram, when there's a spike or anomaly, the device would actually serve as to inflate, and then it will constrict the wrist and serve as a comfort through haptics to calm the user down. That is happening all in real time. And in terms of longitudinal time, especially when they are serving during their shift, the app actually tracks how many episodes this incident occurred. And if it occurs more than a certain number of times, say 5 times, it will vibrate and also send a message out to their supervisors that, hey, one of your team members is not feeling okay. I think you should seek to provide support for this particular team member. And in doing so, we hope that through this verbal release, through a platform whereby they're able to express the issues they're facing with confidentiality, as well as to administer real-time support, we are able to address psychological stress in the workplace and hospital environments. Thank you.
Thank you. lots of nods and smiles while you were talking, especially from the end. Should we start with you?
Oh, look, I think this is a fantastic idea, and it actually has dual purpose, which is great. It's for the person and it's for the organisation. And I think you've really thought about this. It's more a comment from me. I didn't really have any questions.
Yep. Just really resonated.
Yeah.
Yep.
And mine's more a comment as well. I think we all have a responsibility to look after each other in our workplaces, and I think, you know, in the olden days there used to be a work-life balance that we used to talk about, but now with modern technology, with, you know, the use of smartphones, etc., it's more of work-life blending, and people, it's harder to switch off from work outside of the working, you know, environment nowadays because of modern technology. And it's just, to echo your point there, it's just a great thing that needs to happen for the good of our own health and for organisations.
Thank you.
Thank you. Thank you.
Thank you.